So talk me through, Bryce. Where are you looking for?
I'm palpating for the superior medial border of the scap.
Okay.
Gonna go for kind of like this grip.
Yeah.
From there,
How much traction are you trying to get, man?
tons. So you want to be
There
able
you
to
go.
see a little bit of bicep, maybe brachioradialis, and then can I have you scoot down just a little bit for the?
And
Yeah,
also, when you
perfect.
traction this really hard, you should see a little bit of extension by the individual whenever you start to get that thoracic fascia around that.
Yep. So once I feel like I've got the traction, then I'm gonna roll him up and over, and then from there, track him down.
Good pop?
Nope.
Nope. Okay. All right. Feedback. All right. What do y'all think we could do better on that one? Yeah. So again, so I think you good. So maybe even getting a little bit closer to the edge. So you got him here. So what I would recommend is trying to get him right there.
Picking up off
And
that.
so someone else said it best yesterday, and I have never put it this way before. Really, kind of when the ipsilateral or the side closest to you scap starts to come off the table, that's when you know you're forward of vertical. Okay, so that's what allows us to get on that rib body. Okay, all right, let's try that again. And again, so you are at a little bit of a height disadvantage. So if we realize that we're at a height disadvantage, what's the modification that we talked about yesterday? Once you start rolling, it's a point of no return. So don't get here and stop, because then you have no momentum, you have no force to push through. So if you're at a height disadvantage, once we start here, go, 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 pop. Okay? If you are at a proper table height, yes, you can kind of get here vertical and then roll and then sit there for like a quick microseconds and then pulse down. That's fine. But if you're at a height disadvantage, once we roll, it's time to go. All right? You gonna pop?
Nope.
Gonna pop on that one? Josh, Riley, anything?
The roll is
Try
better.
it with a little more traction.
I think you can
more
be just a little more
traction.
powerful with your thrust.
Do you want a stool?
I was gonna say, get a stool.
Yeah.
Does having the 1 foot up help at all?
All right.
You can
Let it rip,
sometimes,
baby.
yeah. So whenever I have done this technique before, I'll try to get here. If I'm in a high disadvantage, I will get the patient here. I'll roll.
We'll say if you want to keep this tension with
They
his
even meant like
arms,
the patients,
do that
like,
little twist grip.
we were doing that like
And
split
you can
stance
control
last
that.
time, where we had like one knee bent. Does that matter?
No, that just helps you roll.
Yeah.
Yep.
Yeah. Pop.
I got a
Small,
small amount.
small little one. Okay, so kind of like Josh said, I would say even more so getting him forward to vertical, as well as I would say a little bit more force. So let me help you out a little bit. Okay, so just kind of a recap. And hey, great job, man. You're not doing bad. There you go. Is that Rob?
That's fine.
Okay, sorry. So I'm right here. Superior medial border of the scap. Middle finger identifies that. Okay. Oops. Traction. What's the one thing y'all already see different between me and what Bryce
He's
said?
pulling it down.
Traction, right? Do you see that coming back into thoracic extension? So
Yeah.
how much traction do you need to get? Quite a bit. Lot. Okay. And again, like Josh said, if you have the hand size, you can do this, or as you start to roll him, you can push him down to tension up the system. Okay. So traction. Roll over. Okay. Still didn't get a little pop, but again, you see the force difference there, getting forward to vertical and how much force I'm actually putting into him. Again, big guy right here, right? Average size guy, like you're gonna.
Thank you.
My point is, again, you're gonna see kind of how out of breath you can get, right? My point is, a lot of y'all, when you start to grade your force, right, it's got to be more than you really think, okay? Especially if you're talking about moving rib bodies, lumbar vertebrae, thoracic vertebrae, things of that nature, okay? Makes sense? All right, so we gotta be forceful. Make sense? There we go. Good job.